Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can check out her website, theburlingtondentist.com. Don't let the title fool you. Yes, she's a dentist, but she's got an area of expertise, I would call it, when it comes to sleep disorders. You could, while you're online, why not just zip her a quick email? You can do that at drbrennerradio@gmail.com. Again, BRENNER, drbrennerradio@gmail.com. Or if you're like me and you'd rather just do it the old-fashioned way, pick up the telly. 860-673-7155. Let me repeat that back to you. I'll slow it down if you want to write it down. 860-673-7155. And if you missed it, don't worry. I'll repeat it again at least a couple of more times before the show is over. Well, good morning. Great to see you. How have you been?
Good. You? Anything new?
What's new? We're in a new month.
Yes,
it's March.
We are. I know. Hard to believe.
And I think tonight we turn our clocks ahead. Spring ahead.
We do.
Fall back. Spring ahead. So we lose an hour of sleep tonight. Yikes.
I know.
But it's the weekend.
Well, so, it doesn't affect us for a couple of days. Did you know that?
I did not know that.
Yeah. That's why when you lose sleep on the first night, you think, I'm doing great. And then a couple of days later, it's like, okay, I'm dying on the vine. So, yeah.
Really?
It takes a couple of days, yeah. The body's very good at adapting on short notice. So think about that. Like, when you had the blizzard.
Oh, a couple weeks ago.
Yeah. So, did you get a lot of sleep that night?
You know what I know? I came into the radio station Sunday night.
Oh, wow.
Because I had to be on the air bright and early Monday morning. And
wow.
it was easier to drive Sunday night, right before. It was snowing, but it wasn't really that bad. And good thing I did, because when I looked out, you couldn't even drive. I mean, the visibility was poor. The roads were slippery. Good thing I got here. But I just slept on a couch and, no pillow.
Oh.
And really, you want to know something? I didn't even really sleep. I tossed it. I was like, I couldn't get comfortable.
Yeah.
It was I look at my watch. It's 1:00 in the morning. I zonk out, and then I'm like, oh, what time is it? I look back up. It's like 1:40. I'm like, oh, that's it. I only slept 40 minutes. So no, it wasn't a good night's sleep.
Yeah. And you did okay on the air that morning, right?
Yes, but you know what? It's a great point, and you're not the only one that brought that up. You know what I think it is? It's mind over matter. If you know you have to perform, I don't know if it's your adrenaline that just kicks in, and then I'm focused. I've got a job. I've got a responsibility.
Right.
And I'm getting paid to do this.
Right. But you did it.
I did it. But I got to you should have saw me at 10 o'clock.
Yeah.
When I got off and then I'm like, what do I have waiting for me when I get home? Oh no! Now I got to get to my snowblower, and that's in the garage, and that's gonna be yeah.
Yeah. Did you get in your driveway? Because the snow is so deep at that point.
Yes, I parked on the street. No, that was the first time the first bad storm. I thought that was even worse. I was able to kind of pull it. I have like this old beat up RAV4 that I drive I only drive it for a couple of months out of the year, winter months. If I hit a snowbank, I'm not crying. I don't care. It's not my normal
got all-wheel
vehicle.
Drive on it.
Yeah, so I pull it, and then I was able to get to everything from there. Yeah, I'm not a winter person. How did you handle it?
I sat in the house and watched the blizzard. I made sure I filled up my bird feeders ahead of time so the little birdies got to eat.
What did you do with appointments? I mean...
Oh, no, we had to cancel.
Yeah.
Yeah, that Sunday before, we kind of knew they were giving us enough warnings on Saturday that said this is going to be bad. And so Sunday, I told my staff, we're not coming in on Monday, we're staying home. And you know what? People don't want to come out in this weather. And the state went into emergency mode. Like, they don't want anybody on the roads. And, think about how many accidents happen just when they don't do that, right? And they just have a normal, snow. You get maybe 3 or 4 inches, and there's accidents everywhere.
You talk about daylight savings. We talk about the blizzard from a couple of weeks ago and the lack of sleep. Are there signs? Let me ask you it this way. What signs should we or do we look for when our bodies are struggling with sleep?
Okay. So there's a really good question, right? because everybody has a different reaction. Remember, we talked about does our body
Everybody's
adapt?
different. You're right.
So some people, they can't function at all. They look like they're drunk. Okay, the eyeballs are rolling back in their head. And
I know somebody like that.
And their head's bobbing, and they're trying to keep it upright. Right, you can tell they're like on the verge of going to sleep. They're standing up or they're sitting down, but they're crashing. Right. So where is the alarm system? So our body has an alarm system that it sets off. Right, and so. For those of you who have the bobbing head and you're driving a car, that means
no, don't do that.
Right, you should pull over, right? You need to find a rest area. You need to pull over and you need to sleep.
Yeah, that's
Even
serious.
if it's a half an hour, it's going to be better than having a car accident, right? So one of the things that I typically see, so we're going to talk about the kind of people that I see come in, because pain drives people to the doctor. Would you agree? Okay.
Universally.
Right.
Any pain.
Any pain. But if you have face pain, right, most people think, I'm going to go to a dentist, okay? If you have a jaw joint pain, what they call TMJ pain, you're going to go to the dentist. Some of them go to their primary care, and the primary care puts them on what they call soft diet, NSAIDs, which are your Advils and Tylenols, and they tell them to eat soft food, okay?
Temporarily?
Well, some people do that for months and months. Some people don't understand that should be like a 2-week thing. Now, if you got hit with a soccer ball in the face, okay, I can understand.
Well, now we know the cause of it then.
Right. That's an injury, right? So, but some people, they've not had that injury, or it hasn't been in close proximity to when they're starting to feel the pain. So, sometimes trauma, which we're talking about car accidents and bad weather, you can get whiplash. You can get hit your steering wheel, right? So those will create some trauma to the face. So we understand the trauma to the face, right? Mm-hmm. We understand the soccer ball in the side of the head. But if you have whiplash and you didn't hit anything, you think, oh, my neck and shoulders bother me, and yeah, I got over that, and I didn't really hit anything, and thank goodness the car wasn't super damaged, but all of this stuff plays a part. Whiplash shows up a year later. A year later.
Yeah, I think you said that last week. I didn't even know that. I always thought it was instant.
No, because the body goes into adaptation mode. So we're adapting. What are we adapting? So maybe we had a slight shift in the cervical vertebra. Maybe we had some other thing that we did. How did the seatbelt go across our body? Okay?
Right.
So there's other areas of the body that get injured, and so our posture changes as an adaptation. Okay? Now, do you ever see a slinky? You ever get a kink in a slinky? Remember those slinkies we played with when we were kids?
I had one.
Okay, me too. We all did. Yeah. What happens when the slinky gets bent?
Yeah, that's not going to go down the steps.
Exactly. It's kind of kinked now.
Yep.
Right? So it doesn't go down the same way. It still will work, but it doesn't work the same way. And so it's not a smooth transition from step to step, right? Sometimes it'll go a little sideways. Sometimes it will stop. So that's what happens to our spine, right? So we're all connected from the top of our head all the way down to our tailbone, right? And the chiropractors are not wrong when they talk about how important that alignment is. But I'm also going to talk about how your sacrum alignment is really important as well. And you think, what does that have to do with anything?
Right.
So I took this course, a very interesting course. And as we adjusted the sacrum on these people, their mouth opening changed.
Really?
Yep. So, and then the instructor told me, he said, okay, Beth's going to go around and she's going to check everybody's range of motion, which is how wide you can open and how you do that. So I was shocked at people who could barely open. After we went through this series of adjustments on their sacrum, they could all open wider. And I was like, huh. Exactly. See, you have the same reaction I did. It's like, I didn't know that. They don't teach that to me in any of the courses that I have ever taken. Okay? So I thought, well, that's interesting. So once again, Is your seatbelt? Remember the old kind of style cars that was across your hips, like in a plane?
When I was a kid, that was the seatbelt in the car.
Correct.
Just across your waist.
But your body's still bent and you hit the steering wheel. So now we have the shoulder strap, right? We got one across the waist, and we got the shoulder strap. So we don't hit our face and we don't face plant on the steering wheel or the dash.
Instead you got something else coming up.
Right, right. So when we're looking at how our body's aligned, I look at posture. Now, people look at me and I'm like, okay, stand over here in the middle of the room. Okay, you stand in a relaxed position because we're not at attention here, right? How do you normally stand? So I look and see where is their head, or did they have a head tilt? Okay, head tilts are very interesting. Where are their shoulders even on both sides? So that gives me an idea about how the curvature of the spine is going. And if I see that their head is forward of their shoulders when they turn sideways, that's a forward head posture. That gives me an indication that we've got airway issues. Okay? So when you're repositioning your body, we're now not in the same alignment. Interestingly, we get the soft palate goes into a different position. We've actually pushed that closer to the spine when we're in a forward head position. That closes off your airway a little more.
Huh.
I know. And you'd think, what is she looking there in the back of my throat? What is she looking at? Okay, so I look for certain key things. And so some people get symptoms and it's like, oh, so they've got this problem. That usually means I'm looking over here at this area of the body. So when I see the head tilt, okay, I'm thinking C1, C2. Okay, where is their body aligned there? So some people have what we call an atlas. So the chiropractors all know about how you sit on your skull sits on your first cervical vertebra. And what a lot of people don't know is their bite is the third leg that stabilizes that vertebra. So I tell a lot of patients, I have dentists that don't know that.
Well, you're not, I know you're a dentist, but you've taken time on your own life to explore.
Right. So I take a lot of different kinds of courses. So this is why when I start looking at things, we're talking about how do we handle the whole body? Because it adapts in different ways for different people. And so so when I see like TMJ problems, right, there's some compression issues on that joint. Are they grinding their teeth?
Yeah.
Right. So grinding teeth is an adaptation, but it creates a neurological pathway that sends us, because it starts to create what I call micro traumas. Okay, we're wearing our teeth a little bit. That's a micro trauma. We're wearing on the joint. That's a micro trauma. But we're shoving ourselves over into sympathetic again. Okay, so we start sympathetic. So you see where I go. Now, if your airway's compromised, okay, now what are we doing? Right?
This is serious.
So that's why we start looking at what are you doing? So are we getting, what symptoms are you coming in with? And so when I start talking to people about how do we fix that, and we've talked, I think we had one whole session on things that people can do on their own, right? Changing how you're eating. Maybe use things like grounding, red lights. These are things, I use PEMF, which is a pulsed electromagnetic field. Now, some of these things are expensive and some of them are not too bad. You can get them on Amazon. You can go and look. But these are important kinds of concepts of how do we shift our body from sympathetic into parasympathetic. We're in sympathetic too long, we start to set up some neurological pathways that are more difficult to get you out of. So the longer you're in it and the more your body comes to compromise the system, then we start to see the autoimmune diseases. Chronic fibromyalgia, lupus, multiple sclerosis, IBS, irritable bowel, because some people, that creates like all of those gut issues, right? So when I see people with certain things, and I'll just give you an example. A very nice gentleman came in to see me, and he's got a nice little bowling ball on his belly, okay? And he's not a heavy guy. He's rather slim, but he's got this, as we've classically termed it, a beer belly.
Right. That's what.
And I don't think he drinks beer, but he might. I didn't ask the question, but he's talking to me about he has a TMJ problem. Okay, it's my joint. Okay, well, I checked his joint. He had no signs of any kind of joint problem. His range of motion was really good.
Self-diagnosis.
He didn't have any. He didn't didn't have any kinds of sounds and crunchy stuff. There was nothing. The joint functioned fine. So I said, you don't have a joint problem. You're not going to take an x-ray? I said, I don't need to take an x-ray. Your muscles are causing this. So I said, how is the muscle? So I touched muscles. Well, they're a little tender. He's got them all over his head. So all of his opening, closing, grinding muscles all are talking to him. So think about it. If you run a marathon, do your legs get sore? Okay? If I were to take one muscle, and I typically do my bicep for patients because it's an easy muscle to show, if I worked that muscle all night long, do you think it might be sore?
Sure.
Right. So why aren't muscles in your face sore if you grind all night? Okay? So this is why I tried to get across to him. No, he didn't think, and he had signs of sleep apnea. He was forward head postured. We start looking for all of these signs, right? And I'm saying, no, you have a muscle problem. The muscles are the symptom that brought you in here. The joint's functioning fine, luckily, but you've got probably an airway problem. No, I'm fine. And I said, so some people, you can tell them, but they don't believe you. And so I said, okay, let me know when you're ready for some help, because I can't help him. He's not going to listen. And he might not have sleep apnea badly, but he's got inflammation going on in his body, because I can tell by looking at him. Okay? Right. So it's those are the tough ones, okay?
So he didn't have the problem he thought he had. He got another one. He got a different one.
But it's creating the same pain or a similar pain. But I have to make sure. I will eventually do an x-ray of his head, right, to rule out anything else. But that's where I get to look at the airway problems. So gut issues, when we've talked about this in other shows, swells up the nose, especially while we're sleeping. Okay, it swells it up during the day, but it's worse at night. Okay? So when we're not eating correctly, and I'm going to say correctly is kind of a vague term, eating so that we're not producing more inflammation, okay, which usually means your body is in balance. You're in balance, right? You can eat a few carbs and you're going to be fine, but you eat too many carbs, right? If I eat ice cream every night, and then I've got people that eat ice cream every single day.
That's a weakness of mine too. It's all, folks, it's all fat. It's not good for you.
It's all sugar. If they put the amount of sugar that they put in there.
I know. Maybe once, a couple times a month in the summer, you want to treat yourself. But there was a time years ago I would eat it every night. You can't.
No. So I had a lady that we were fixing her sleep apnea, and she had a bowl of ice cream every night. And she would wake up with these headaches, and then. So I said to her, let's try a different snack at bedtime. What do you like to eat? And I said, let's try some nuts. What kind of nuts do you? She loved macadamias. I said, okay, you get a 1/4 cup of macadamia nuts. That's your snack. So do it for 1 week.
It's not ice cream.
Do it for 1 week. I know. Well, she did that, and her results changed.
Aren't nuts fattening too, though?
But they're protein and good fat.
Peanuts?
Peanuts have mold on them, so you kind of got to be careful about where you get your peanuts.
Like shelled peanuts or the
It doesn't make any
deshelled?
difference.
No.
They have mold. They have mold, and if you're sensitive to mold, you're going to have a problem with it. And people think cashews are nuts, but they're not. That's a seed.
Oh.
Yeah.
Hold on, I got to do something really fast. Folks, you are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com. And write this number down, because in a few minutes, I want you to give her a call, 860-673-7155. Again, 860-673-7155. Go ahead.
So we go back to jaw pain. So jaw pain is the alarm system for our body. That's what's going to clue us in that there's something going on, okay? We ignore that. We go, oh, I must have done something. I slept crooked. Oh, I have neck pain. I must have slept. And sometimes we did sleep crooked, all right? We get over it, right? If it's coming back frequently, I'd say maybe not, okay? I have people that have constant neck pain, right? But they're holding this big bowling ball called your head forward, and for every inch you go forward, that's 10 pounds on your back neck muscles. Okay. And so they wonder why they have shoulder pain. They wonder why they have a problem with breathing, because we're now compromising that airway. Remember I said for every time you move your jaw forward, that roof of the mouth, that soft tissue gets closer to the spine.
Right.
And now we're closing that airway off. Okay.
Yeah, that's when it gets dangerous.
Well, I love to sit in airports and watch people when I'm waiting for my flight. And you sit there and I have people that are looking at the floor, they're so compromised, right? And I have others that, they're sitting there playing especially the kids, they're playing on the phone.
Yeah.
They've all got their mouth open. So I already have all these mouth breathers, right? And I'm like, they're just waiting to have a problem. So we don't typically look at the kids the same way. We think, oh, they're fine, right? And I had parents that pointing out their daughter opened maybe like a quarter of an inch. She didn't have her lips completely closed. I said, she's breathing through her mouth. No, she looks the same. I said, I know, I can see it from here. So I took a piece of paper and I said, hold this piece of paper. How long can you hold it? In 15 seconds, the paper's fluttering because her muscles are so weak because she doesn't keep her lips closed.
Oh, my goodness.
Okay? So it's a test, right? And it's a little test, but it's a test. And so I said, her facial muscles that surround her mouth can't keep her lips closed, and they're very weak. So what happens to people when they can't keep their lips closed and their mouth breathing
They're
all
breathing
the time?
through their mouth.
What happens? What happens to the mouth? Okay? All of a sudden, we get 3 and 4 and 5-year-olds that get enormous tonsils.
Oh.
Why? Why do people during COVID got COVID more quickly than others? They're mouth breathers. I used to say to all of my patients during COVID, and right before we had the shutdown, I'm like, if you go to the store, because they weren't requiring masks, some people were wearing them, and I said, okay, don't breathe through your mouth when you go into the store, right? Because we all had to go to the grocery store.
Yeah, right.
Don't open your mouth. Don't talk. You can keep it limited. Breathe through your nose, because that nose has so many functions. It's got close to 300 functions of our nose. And one of them is warming the air and filtering the air. And then the chemistry of our nose, because we produce nitric oxide in our maxillary sinuses that kill off germs. So anything that floats through the air, that floats into your nose, and the hairs catch everything, right? So that's why flies don't go up our nose. Just a little thing there. So, but if you suck it in through your mouth, and so I used to think, okay, the motorcycle riders, and you see them going along without any kind of helmet on. I'm like, can you imagine the bugs that smack into their face? Okay.
Eyes.
Yeah.
You gotta wear eye protection, even if it's just goggles.
Right.
Yeah.
But if you're breathing as a person, you're sucking in all the germs in the air straight into your lungs. And what's our only defense in our throat? Our tonsils. Right? And these ENTs take them out. Oh, they're 3 and 5 years old. They got infections all the time. Well, they have a problem breathing, right? There's a problem here with what I call a sleep disordered breathing. They have a problem breathing. They don't fix the problem. They just take out the obstruction, and then they're good for about 3 months, and then it all starts up again. And the studies are out there. So I want to educate all parents. But you know what? It's really hard for me to battle against the ENTs and the pediatricians who don't see this. So, and peanut butter is one of our biggest things.
It's another one of my weakness.
Yeah, well, we ate peanut butter all the time. How many kids did you know?
Every day.
We didn't. How many people did we see that were allergic to peanut butter?
Nobody.
Right. Now you can't have peanut butter on the plane because there's somebody on the plane with a severe allergic reaction to peanuts.
I can go for a Reese's peanut butter cup right about now. That's my weakness, too. Combine that with the ice cream. Forget it. I'm done. So, obviously, these exposure to toxins, your diet overall. I mean, this...
So you have to think about what you're eating. If you choose to eat, fine. Just know what you're eating, okay? And we can talk about detoxing, but there's ways to detox. We talked a little bit about that last. Fasting is another way of detoxing, yeah. Oh. So, these are all important.
Wow.
Yeah.
What I learned here.
Well, we learn all kinds of good stuff. So, so when the jaw is being fueled by that sympathetic nervous system, as you're going to grind and clench a lot more, and you wonder why your face hurts. you wonder why your jaw starts getting crunchy sounds. Now, some people come in and they're like, well, it's been like this for 20 years. I told my dentist about it.
Then you've had it for 20 years.
Right.
Could have done something about it years ago.
Well, but they had it even before that. So think about it. It doesn't just start with pain and crunchy stuff. It starts before you get all of that.
Better late than never, though. At least you're doing something about it now. So going forward, you'll be fine.
So, yeah. Anyway, so we want to make sure that we're watching what we eat, right? And like somebody said, I watch it go from my plate into my mouth.
Well, we should always watch what we eat, though.
Well, yeah. So this is why I try to tell people eat organic as much as possible and try to avoid. Now, there's a big thing. I know we have GMO products, so I'm going to take my moment here and say glyphosate is a carcinogen, okay? And they put it in all of our food, and they tell us it's perfectly okay to eat it. Okay? So I have a problem with that. And I keep wondering why our illustrious head of our health system, Mr. Kennedy, I wish he would say to them, you can't put the glyphosate, the GMO products into food and give it to people because they don't know.
Monsanto. That's what it is.
Yeah.
All right. I got a minute left.
You do?
Yeah.
Okay. What do you want to talk about?
Whatever you like. It's your minute. Whatever you like.
Well, let's see. What else could we talk about?
Well, we don't have that much time, but I want people to call you.
Well, if they're having face pain, so I had a lady this week.
Because more people, I think you hit on something a moment ago.
Yeah.
I think this is going misdiagnosed.
I don't think the alarm bells are going off in anybody's head.
Exactly.
Yeah. So if you see wear on teeth, that's a sign. Okay.
Okay.
And we were taught in dental school to make a night guard. And we know
that could be part of the solution as well.
And
We've talked about
50% of the night guards make you worse.
860-673-7155. I would say call it right now. Call the number right now. 860-673-7155. Online at theburlingtondentist.com. And if you'd rather just zipper over a quick email, you can send it to drbrennerradio@gmail.com. Brenner is Brenner. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.